For more on Cyclone Chido, I'm joined live via Skype from Pemba, Mozambique by Nicholas Wasunna, Chief Field Operations and Emergency at UNICEF. Nicholas, welcome to Africa 54.
Yeah, thank you.
Do we know how many people in Mozambique have been affected by Cyclone Chido so far?
Currently, we're seeing numbers of about 329,000 people, and that number is increasing. It does include 171,000 children. So this cyclone was devastating.
And which are the hardest which are the hardest hit parts in Mozambique, where when you go around the country, looking at what's happening in terms of helping and all of that? Which ones would you single out?
Where I'm based in the north is the hardest hit, in a province called Cabo Delgado and our neighboring province, Nampula. This is where Tropical Cyclone Chido hit and it moved inland. So I've seen the devastation that it's caused. It was a big constraint on our work because telecommunications were down, power was down. We couldn't communicate, we could hardly move, but now we've opened the roads, the pylons are getting back up, power's up, and we already started from Monday doing our assessments, Monday last week doing our assessments, and we started to respond immediately.
So how are you responding to especially some of those really hardest hit by this cyclone? What are you giving them? What kind of aid, food, water maybe? What's happening?
We have pre-positioned stock already available, and with sister agencies, UNICEF moves to these communities very quickly to provide sanitation, clean water, food, shelter material. The immediate needs of the people now are shelter material, food, and clean water and sanitation. We do have a concern about disease, and therefore we need to do everything we can to ensure that disease does not spread.
So what kind of diseases are you probably seeing by now? We hear of, when the water is dirty, cholera outbreaks are the norm, and maybe other waterborne diseases. What are you seeing on the ground?
In our neighboring province, there is cholera, and we are concerned here in Cabo Delgado that it is going to spread. Therefore, we have put cholera treatment centers in place. We have already mapped out the hotspots for cholera. We're providing clean water. We're treating water. We're providing mass communication to populations on sanitation, hygiene. We're providing soap. And so we're getting ready for a cholera outbreak.
Other than UNICEF and the kind of aid you're offering those who are really hit hardest there, how else are you able to reach out to probably some of the people that are really far off from where you are? And are hospitals actually functioning in that area at all?
So in Cabo Delgado, over 32 health facilities were either partially destroyed or totally destroyed. We've already set up with the government, who are leading the response, tents. We're providing health services. We're trying to get the system back up and running, and therefore we're reaching communities through traditional methods, through the setup within communities, and we're ensuring that all those who need assistance can get assistance. It is a difficult job, and we're not there yet. We need more resources. However, we are also seeing the impact of climate change, especially on children. We're just at the beginning of the cyclone season, and we've already been hit hard. The rains are due to come and fairly heavy within the next few days, so we need people to have shelter. We need them to have a place where they can feel safe and secure.
Nick, oftentimes we hear that people giving aid to places where people are really going through a hard time, like we've heard about Sudan, does have some effect on you as a personnel. How has this hit you as UNICEF staffers working and seeing what's happening? Some people have lost their lives, some are little children, some are just women, and they're helpless. How does that impact you?
Certainly, a cyclone impacts everybody. I myself was here when the cyclone was happening. The room I was in was flooding, so I can sense what it's like. However, I was in a concrete building, so I just feel for those who are in bamboo structures. There is psychosocial support that we provide for our staff. Staff care is very important, but we are trained to deal in these kind of situations, and therefore ours is immediately to respond, especially to children.
Do you have other aid organizations working alongside UNICEF?
Oh, yes, the whole UN machinery is here. We have the INGOs, NGOs, local communities. And we're all coordinated through the government structures. Therefore, we are a well-coordinated operation, and that is why we could launch a response to Tropical Cyclone Chido so quickly.